Hi, my name is Jennifer Coffey, and I'm from Manchester, New Hampshire. I have spent years of my life working in healthcare. I was an EMT and an LNA, and about 20 years of my life was spent either in an ambulance or in an emergency department taking care of people. And in 2013, I found myself on the other side of this with breast cancer. And unfortunately, that breast cancer turned into some rare diseases that I didn't even know existed, and I was a healthcare worker. I have what's called CRPS, complex regional pain syndrome, and I also have small fiber neuropathy. But CRPS is also known as the suicide disease. And I share this with you because it's really weird to be on this side of it now. When I was working in medicine, I never imagined not treating a patient. But now, being on this side of it, I find that I can't access the same healthcare that I work to give. There are treatments and things that can be done, but they're held away from me through denials by United Healthcare, not allowing me to have access to treatments, to the point where I suffered so incredibly that I was in the hospital all the time, every month. I was given so many medications, I couldn't think straight. I couldn't remember things. I would go through horrific treatments where they would shove these needles into places in my body to try and deaden the pain. And you could hear me scream in the waiting room it wasn't done in the least amount of suffering. It was suffering. You suffered just to try and get out of just a titch of the pain. I ended up selling everything I owned. I lost my career when the cancer hit and I couldn't get better. And the small fiber neuropathy has caused my body to destroy all of the small fibers that live in your epidermis. And I've barely got detectively 1% or actually less thereof in my dermis. My body is attacking itself. And it's not my fault. I got breast cancer. But when I need treatment, like my ketamine infusions or low-dose naloxone that have helped me immensely, United Healthcare said, no, we won't pay. And they haven't. In all these years, the only reason I sit here today is because I have kept myself alive through borrowing, through selling, through doing whatever I could to get the money that was needed in order to buy the treatment to keep me alive. It's literally that. If I don't buy the treatment, I die. I'm not going to make it. But United Healthcare just red stamps everything that comes to me, so it's all on me. And I don't think it's right that I pay to have healthcare, that I worked in healthcare, that I did everything right, and I never asked to get cancer. And now, when I need it, it's denied to me by United Healthcare. It's time that these Medicare Advantage plans actually did the right thing and provided the treatment that I'm entitled to. I paid in for this. I paid for this insurance, and I helped to administer the care for other people who paid insurance. It's me or nothing. No money, no drugs. No money, no treatment. No money, no life. And I might as well have no insurance because United Healthcare's Medicare Advantage program denies me more than it'll ever approve. When I was a Republican state representative, I supported ideas like uniting insurance policies across state lines, trying to make it easier for people to get healthcare, that we had to have a better way. But I was wrong. And I realize now, unfortunately, in part because of my own situation, I'll admit it, that universal healthcare is the only way that everybody's life is going to matter. Because as it is right now, your life only matters for as long as you can pay the bill. Please do us all the great need that we have. Please help us by sharing this information, tagging it with United Healthcare, sign the petitions that are out there to help, and send a message to the CEO of United Healthcare and let them know that we are going to hold you responsible. There are thousands of people like me out there that have the suicide disease, that are going to die or are going to commit suicide because they can't access treatment. They can't access care because United Healthcare and organizations like them that supply these so-called Medicare Advantage plans is not covering the life-saving treatment that people with the rare disease I have. And there are people in this nation, thousands of us, and some of them children. Please share, sign, and help. It's time that everybody had access to health care, no matter what their station in life.